two other interesting patients we have been women who were in automobile crashes, and they were brain dead. They were declared dead, but they were both pregnant. One was 5 months pregnant, and one was 7 months pregnant. So we were asked with other people and ethicists what would be the right thing to do, because in one instance the father survived and he wanted to have the baby, if possible, of his brain-dead wife. In the other instance, the father was dead, the mother was brain-dead, and the grandparents wanted to have the grandchild as the legacy of their children. So we fed both of these women intravenously with TPN, and both of them delivered live, viable, beautiful children, cesarean section. We actually were using the brain-dead woman as a life support system for the baby, together with the TPN. And it was an interesting experience. As you heard from Jose Antonio, you almost feel like you are a godfather of these children, because they would not have survived without superhuman efforts. And we are very pleased to also have fed many patients that are pregnant that have problems. Some, but they had simpler problems like acute cholecystitis, never the magnitude of what Dr. Jose Antonio Carrasco described to you. The last thing I'd like to say is you must be careful if you have twisted dead bowel. You may want to untwist it, but if you untwist it, you take the big risk of releasing an enormous amount of toxin from the dead bowel into the circulation. And remember, if you listen to Dr. Carrasco carefully, he said there was no chemical inflammatory response. And it probably was your good judgment at the time of the operation that prohibited that, or prevented it, or minimized it. This has been a most fascinating session. All of you have been enormously adventurous and pioneering. One of my associates who took my job when I gave up my chairmanship in surgery, a Cuban who came to the United States when he was 8 years old, Juan Sanchez, is a thoracic surgeon, and he has put in several videoscopic right auricular catheters. He says it's simple. So for what might be unthinkable for some people is routine for others. Wonderful session. Congratulations, and thank you for the opportunity to comment.
Muchísimas gracias. Bueno, muchísimas gracias. Vamos por concluir este simposio. Son las 11:49 de la mañana. A las 12 en punto reanudamos con la conferencia.